Hi, my name is Dr. Blake Butler, and I'm a functional medicine provider with Align Modern Health. And today we are going to talk about SIBO. SIBO, which stands for small intestinal bacterial overgrowth, is an overgrowth of bacteria in the small intestinal environment. Typically, we don't expect to have bacteria in a large amount in that environment, and therefore we see a lot of symptoms associated with that bacteria within the small intestine. We often see severe bloating. Typically, that bloating occurs within the upper abdomen. Beyond that, we see irregular bowel movements, in some cases loose stools, in other cases constipation or IBS-like symptoms. In fact, there's a strong correlation between IBS and SIBO, and oftentimes SIBO is undiagnosed in those situations, so it's important to perform the appropriate testing. In fact, yes, probiotic therapy can aggravate SIBO. And many times if someone takes a probiotic and they experience bloating, that's a potential indicator that SIBO is something that we must rule out. So probiotics have their place in healthcare. However, in many cases, people don't benefit from them, or they can actually aggravate symptoms. And that's very common with SIBO in particular. Typically, from a functional standpoint, we perform comprehensive testing, specifically a hydrogen methane breath test that can be performed in the comfort of one's home. That allows us to look at gas production that associates essentially with bacteria that we see with SIBO. And from a treatment perspective, we use specific strategies to treat whatever bacteria is present from a conservative point of view with dietary modification and what's called antimicrobial therapy to help eliminate the bad bacteria so we can resolve or potentially reverse the overgrowth of bacteria that contributes to the bloating and the irregular symptoms.